The definition of burnout basically um, defined in this specific article was the syndrome of emotional exhaustion and synthesis. And this was also similarly to other sources as well that both that all that most articles defined the factors of burnout as depersonalization, which um, refers to mainly three defining factors that include depersonalization, emotional exhaustion, and decrease in personal accomplishments. Depersonalization basically refers to mainly the negative um, attitudes and feelings of one's patients or clients towards a specific from either a specific environment, from a specific negative behavior that either the psychologist or patient might have towards a specific situation. Um, um, and emotional exhaustion refers to the lack of emotional resources, um, like the ways of empathy that most psychologists have trouble relating to the attitudes or feelings of their specific clinical psychology training. Basically meaning that they can't interfere, which is also stated in other sources that they must not interfere with their personal feelings and their feelings in the workspace. Also, um, there's a decrease of personal accomplishment is mainly the way they are evaluating themselves or the way of treatments in a negative way that is being perceived, which also connects to the fact that personal achievement may cause stress of confidence, stress on the personal psychologist who might um, worry on perfectionism, also related in other sources. Also, as well as that, there is the research sees clinical psychologists um, having intense personal nature of work and type of patients I work to deal with that lead to the risk of a higher burnout rate. The overall purpose of the study that the researcher used for more current information about more current information towards um, burnout burnout being defined by different aspects and variables. Um, Basically relates to the relationship between work setting and levels of burnout among the clinical psychologists working in the correctional institutions. Also, the types of surveys that was used were psychological practice experiences and attitudes and an attitude survey that in total contains six different sections, and it it was passed to around 580. There was around 588 surveys passed out with a 49% rate of them being returned back and completed, since some of the other patients that were being used in the specific survey at last minute had the right to leave, um, and and who returned, and 49% of them who returned, and by those those who participated in the specific survey also had a doctoral degree in psychology. And in terms of burnout of different variables such as age, gender, race, and even years worked in a specific workplace or corrections, it helped develop the results of of what the researchers basically wanted to find out. And in the results provided by the researchers, some results included the age. That age was related to burnout, because unlike um, other articles, older respondents were older respondents tended to report less exhaustion and less depersonalization, And also the different characteristics of work environments basically also explained in other sources that there might be an overpopulation of inmates that might affect the inmates' behaviors, and that affects the way that the inmates' behaviors goes towards the actual clinical psychologist. And 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 also, going back to the age, it also resulted in older respondents tending to report less exhaustion and less depersonalization in total of the actual meaning of burnout. Also, going back, returning back to the work environment, that it basically played a very significant role, as explained earlier, towards burnout, because of what I had mentioned. Um, and basically, the researchers finally provided that there is different specific risk factors that don't really pinpoint is exactly a very factual burnout explanation. But basically, the risk factors that contribute to burnout would be control over work activities, working longer hours, dealing with negative client behaviors, and so on and so forth, in developing the entire idea of burnout.